Let's revisit COVID. Concerning increases in COVID hospitalizations in the past week suggest a new wave of infections is underway. This is according to health officials. So there were 9,631 people in hospital with coronavirus as of October the 5th. That's a 37% increase on last week's, which was 7,024. This is also the highest figure since the 3rd of August. The COVID-19 hospital admission rate in England is also up from the previous week. Is there cause for concern, though? I mean, it's what a hospital is meant to do, right? Only one way to find out. The independent statistician Jamie Jenkins joins us now. Jamie, good afternoon to you. We know, you know better than I. Always beware of a headline because there's often a little bit more lurking behind it.
Yeah, good afternoon, Ian. I think what we're seeing at the moment is this kind of new wave of COVID across the country. So that's kind of being borne out by the kind of the independent stats that the ONS do, where they kind of do random testing across the country. We are seeing upticks there. And the hospital figures are going up as well. It's not surprising now because we're at that point of the year, Ian, where we do see respiratory viruses start to thrive a little bit. We saw it in 2020, we saw it in 2021. But I think I wouldn't go too much down the kind of the alarmism in terms of what we got at the moment. Yeah. So when you see headlines of, say, 30%, 40% rises, when the numbers are relatively low, then you get some big percentages because you're coming from a low base. So that's one thing to consider. Also, remember now that the vast majority of patients who are in hospital with COVID actually are in for other things, but they've happened to test positive in the hospital. So it's only around a third of the so it's only around a third of the patients who are in hospital with COVID are specifically for it. But that is going up. Can't deny that. We're seeing a bit of an increasing issue, Ian, and that more and more patients are catching COVID in hospitals. So whether or not some of the infection control is a bit more lax now where we are in the kind of the course of the pandemic. But that's kind of looking at the broader general hospital. If we look at more the kind of the severe illness and more on the death side of things, then since the Omicron variant hit us last December, the number of patients in intensive care is a fraction of what it was in the kind of the height of the pandemic a couple of years ago. Mm-hmm. We've got a significant proportion of the population now, over kind of 97% of the population of adults have antibodies. So we're in a much different place. So obviously some people have had vaccination, some people have had the virus more than once as well. So it's a much different place to where we were this time, say in 2020 and in 2021.
Yeah. Is anybody like getting jabbed now for this? And I don't speak to anybody. And are those big testing centres? Are they all closed down? Do we know, Jamie?
Yeah, the vast majority they are testing people as they go into hospital. It depends on the cohort of people that you kind of mix with when you're talking about the vaccinations, because at the moment they're kind of doing the new rollout for the very elderly. They're not going to be going like Boris suggested last year, boosting everybody down to the age of 18. So that's not on the cards. There's kind of, they're adopting more of that, how we manage the flu kind of pandemic, where they prioritise the vaccine for kind of those more vulnerable groups. So, sure. So it's unlikely you're going to see, like, I'm in an age group where I wouldn't be eligible for a vaccine now. And so I wouldn't know many people who are having vaccines myself either.
Yeah, indeed. Jamie, thank you as ever. Jamie Jenkins, independent statistician.